Organ transplantation. With the beginning of 20th century, organ transplant operations began by transferring a healthy organ from a living or recently deceased donor to the patient's body in case of the failure of that organ function in the patient. Cases of organ transplantation include kidney transplant in cases of chronic renal failure, whole or partial liver transplant from living donor in case of advanced liver failure and some cases of liver tumor, pancreas and islet cell transplantation for diabetic patients, and radical intestinal resection, which is still experimental in a limited number of global centers. Lung and heart transplantation, experimental in a limited number of advanced global centers for the patients with lung and heart failure. Corneal transplantation, where the cornea is transferred from a recently deceased person to a patient with a corneal opacity, giving them a possibility of vision. If the cornea is left in the globe, it deteriorates within hours. Kidney and liver transplant operations are performed successfully in Egypt for several years through donation by relatives of the patient, but they are costly operations and require post-operative immunosuppressive drugs, though the body does not reject the new transplanted organ.